Zachary Tan and Dr. Alfonso Herrera from St. Luke's General Hospital in Kilkenny. Our project was focused on airway management, psychomotor skill improvement, and the role of immersive reality. Our aim was to teach practicing doctors, medical students, and emergency paramedics how to correctly insert a laryngeal mask airway, or LMA for short. These are used in the medical industry to facilitate insertion of endotracheal tubes when intubation fails, as well as to keep a patient's airway open during anesthesia. These can also be used in emergency scenarios to deliver oxygen, medication, and surfactant. In the current teaching method of LMA insertion, lifelike practice mannequins are commonly used. They typically cost between €1,000 and €3,000. As well as this, they are also impractical for teaching scenarios where an LMA needs to be inserted quickly, and other factors may need to be considered, such as a patient's weight or age. These mannequins, as a result, do not inspire confidence in students, as they cannot simulate what they'll be facing in real-world scenarios. In an attempt to curb these issues, students undergo intensive and exhaustive training with clinicians. The problem with this, though, is that it takes up a considerable amount of valuable and limited time that the clinicians have, and the mannequins take up a lot of physical space. We play tested our game with a handful of medical students from UCD and the National Ambulance Service. Before they played the game, we ensured the VR equipment was set up correctly. We also instructed them to stand directly in front of the motion sensors and to ensure the controllers were secured to their wrists. We also stated that if they experienced any symptoms of VR sickness, such as dizziness, headaches, or disorientation, they should immediately stop playing and remove the VR headset. In the prototype they played, we had a tutorial scene where they could get accustomed to the controls. In this scene, we had a picture puzzle where they needed to put the LMA procedure steps in order. We also had a true or false quiz which tested their academic knowledge in regard to the procedure. We then had an operating room level where the players were shown animations on the procedure steps, and they were then instructed to attempt an LMA insertion into a patient. The feedback we received from the playtesters was overwhelmingly positive. They each stated that they enjoyed the game, the steps were accurately conveyed, and they saw a lot of potential in the project. The biggest limitation we suffered was that we could not accurately simulate the physical sensation of insertion. However, with our game, we can create multiple scenarios. For example, we can have it where the player may need to insert an LMA into a premature baby, an elderly person, or even an overweight individual, for example. This would eliminate the need for a series of specific and expensive mannequins. As we are introducing gamified elements such as game modes and leaderboards, we can make the learning experience far more enjoyable. We hope this will lead to better retention of the procedure. Our game is also very portable, as it can be played with just a virtual reality headset. Thank you for listening. If you have any questions, please don't hesitate to ask.
Thanks, Connor. That's really interesting. I'm sure this is an area that we're going to explore more and more, especially given the current restrictions. Someone has submitted a question. I'm not sure if you'll be able to answer this from your simulation, but they have asked, do you have to approach the procedure differently when inserting an LMA into an infant?
Yeah, it's a good question. You do. The pediatric airway is different than the adult one. For example, infants have a larger tongue, a larger epiglottis, their larynx is more anteriorly located, they have more acute angle of their posterior pharyngeal wall, and you have to look out for things like tonsillar hypertrophy, so just swelling of the tonsils would be harder to insert then. So you'd have to assess, is it actually a viable solution now to insert, or if you should look at another solution.
That's great. I might just ask a second question quickly. Where are you going next with this? Do you have other plans from here?
Yeah. So we've already started working on the next stage of the project. So what we're looking at to do now is to try and remove controllers from it. Just because I have one here, people found it difficult to pick up and understand. So we found a new headset called an Oculus Quest. And what they have is hand tracking. So it has cameras here that will track your actual hands, just so it's much easier for people to just pick up and learn how to do. So that would be our next goal for it. And we're getting a lot of good feedback from it. So just yesterday, we got a runner-up for the best technological advancement at the Emerge Game Awards. So we have a lot of prospects there, and we're currently looking for funding to help further the project.
That's great. I think this is something to watch going forward. Thank you for your talk. I'm going to hand back to Katie then for our next